These are our spinal hygiene stretches. This is critical in how we care for you. This is that teamwork part that we talked about within that first week. So within this first week, we'll have you do these stretches twice a day, and then after the first week, we'll have you do them once a day. So we'll start with these doorway stretches. So keep in mind that we want our elbows in line with our shoulders like this, and then we'll have you kind of walk through a little bit there until you feel that stretch within that chest and shoulder area, and we'll hold that for 30 seconds. So our next stretch is our anterior head carriage stretch, or our wall stretch. Keep in mind we want to have a solid wall up against behind us, and the goal is to have our ears over our shoulders. So we're going to have 5 points of contact here. We have our heels up against the wall, our glutes up against the wall, our shoulders up against the wall, our hands, and now we're going to tuck that chin and press up against the wall. We're going to do that 10 times for 5 seconds each. So if you want more from this stretch, let's try the advanced version, where now we still want to keep those 5 points of contact, heels, glutes, shoulders, but now we're going to bring the hands up. And now we're going to also make sure that we tuck our chins and push against the wall there. And we'll do that 10 times for 5 seconds each.
Next, we have our daily spinal ranges of motion. For each of these exercises, you'll perform them on both sides of the body. And I want you to go as far into each stretch as you can without causing pain, and holding for 15 seconds. The first one I'm going to show you is left lateral flexion of the neck. So for this one, you're going to take your left hand and put it behind your back and grab on with your right hand. And then you're just going to apply a little bit of pressure and tilt your head to the right. And then you're going to hold that for 15 seconds, and then do the same thing over to the right side, grabbing the right wrist here. The next one is neck or cervical rotation. For this one, you're going to take your nose and turn it as far as you can over to the right and then to the left. And once again, holding that as far as you can for 15 seconds. If you have any dizziness at all with any of these exercises, we want you to stop performing those and let your chiropractor know. The next one is neck or cervical extension. For this one, you're going to take your chin and your nose and jut it up as far up as you can. And once again, you're going to hold that for 15 seconds. And then the next one is neck flexion or cervical flexion. So this one, you're going to take your chin and tuck it down and look down as far as you can. Once again, holding for 15 seconds. Next is spinal or lumbar flexion. So with this one, you're going to put your feet about shoulder width apart, keeping your legs as straight as you can, and you're going to bend forward and hold that position for 15 seconds. And then you have spinal extension. So this one, place your hands on the lower back here, and you're going to jut your back as far as you can. Once again, holding for 15 seconds. Next, we have lateral bend or lateral flexion. So placing the hands on either side here, keeping your feet shoulder width apart, you're going to bend down, and kind of like you're trying to reach your knee over on the right side, holding for 15 seconds. And then you'll do the same thing over on the left then as well. And then lastly, we have spinal rotation or thoracic rotation. For this one, you're going to take your arms and point them forward, thumbs facing up, keeping your feet in one position about shoulder width apart. You're going to twist your spine over to the right as far as you can, and your nose can follow that as well. And then same thing over to the left side then too, holding each of those for 15 seconds. Let us know if there's any questions.
Okay, so next we have our YWTL stretches. This kind of focuses more on our pinching our shoulder blades together. So we want to keep in mind to keep our thumbs backwards as we do these exercises so we can protect our shoulders here. So for this first one, we're going to have you put your arms up like this. We're going to have you take a deep breath in and blow all the way out and squeeze your shoulder blades together and hold for 15 seconds. Next, we have our W's. We're going to do this position, have our elbows kind of close here, and then we're going to squeeze our shoulder blades together as we take a deep breath in and all the way out and squeeze, and we'll hold for 15 seconds. Next, we have our T. So that's kind of just having our arms straight out here with our thumbs backwards. We're going to have you take a deep breath in and blow all the way out and squeeze those shoulder blades together and hold for 15 seconds. Our last one here, we have our L's. So we're going to have our elbows close to our sides here. Have you take a deep breath in and all the way out and squeeze those shoulder blades together and hold for 15 seconds.
Okay, I'm going to demonstrate the cat and camel stretch for you guys. So Ideally, if we can do this 3 times per day, but at minimum twice per day, this is going to help to stretch out the low back and the hips. So what you can do is you can do this in bed or on the floor. And what you'll be doing is you'll be on all fours. The hands will be underneath the shoulders. The knees will be underneath the hips. And you're going to think about what you're doing with your belly button. So you're going to start by dropping the belly button down towards the floor. And take a deep breath in. And hold for 2 seconds. And then let it out. And go up with the belly button. Hold for 2 to 3 seconds. And then alternate between this. And what this is going to do is it's going to stretch out the muscles along the spine and the hips, and it's also going to pump the discs in between the spine then as well. Do this 2 to 3 times per day for 1 to 2 minutes at a time. Okay, we're going to show you the modified version of the cat and camel stretch so that if you're not comfortable getting down on all fours, this one can be a good option then as well. So if you're sitting, what you're going to do, hands on the knees, you're going to start by taking a deep breath in and extending your head and your low back like this. Hold for 2 to 3 seconds. And then what you're going to do is you're going to exhale, and it's like you're going to be looking down at your belly button. So you're going to take the curve out of the low back. You should feel a stretch across the low back. Hold for 2 to 3 seconds. Take a deep breath in. And then exhale. Doing this 2 to 3 times per day, it should feel like a stretch. If there's any pain or discomfort, you're stretching too far, just go through lesser ranges of motion. Okay, we're going to be showing you guys the leg swing exercise, and this one's important because it's an active stretch that helps to stretch out the low back and the hip joints. It's an easy one to do, doing it for 1 minute on each leg, and only go to the point of comfort. If you have any pain while doing this, just go through lesser ranges of motion here. So basically you're just going to be swinging the legs straight forward, straight back like a pendulum, and it should be a nice easy stretch as you're doing this. It shouldn't feel uncomfortable. Once you've done 1 minute on one leg, switch over to the other leg. Make sure that you're holding on to something so that you don't lose your balance here. Okay? Do that 3 times per day.